This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. We'll be focusing in on Mon Pathways to Success program this morning. So let's bring in our guest. Paulina Nottingham is Development Specialist, Mon Health Medical Center Foundation. Good morning, Paulina.
Good morning.
And we also have Lotoya Henry-Ojugbana, the Director of Talent Acquisition at Mon Health System. Good morning, Lotoya.
Good morning.
Well, guys, thanks for taking a few minutes with us today. Before we jump into the matter at hand, we always like to get to know our guests just a little bit better. Let's see, eeny, meeny, miny, mo. Lotoya, let's start with you this morning. Just tell us about your background, where you're from, where you went to school, and how you ended up with Mon Health.
Absolutely. So I'm actually originally from Jamaica. The little accent comes out now and then, but we relocated to Morgantown, West Virginia from the Lehigh Valley in Pennsylvania. Mon Health was gracious enough to reach out to me about this great opportunity to head up their recruitment division, and I came, explored West Virginia. It surprised me. I fell in love with the mountains and the views and the people, and said absolutely I'd be more than honored to join Mon Health and help them with recruitment, hiring, our nurses. It's just developing who we are in this community.
And go ahead, Lotoya.
No, that's me in a nutshell.
All right. And also, Paulina, same question to you.
Yes, so I was originally born in West Virginia, and then I moved around a little bit, and I came back to West Virginia for college, and similar to Lotoya, just fell in love and decided that this is where I want to stay. And I ended up at Mon Health because I always wanted to get involved in healthcare, and I felt like it was the perfect opportunity to get involved in community healthcare where you really see the impact.
Mentioned earlier, we're going to focus in on the Mon Pathways to Success program. Lotoya, as the Director of Talent Acquisition, that title sounds self-explanatory, but what is your role?
Sure. So I'm the Assistant Director for Talent Acquisition, which means my role is in recruitment. And so all the hiring that happens in the health system, I oversee that to make sure that we're bringing in the right people to serve our community.
And Paulina, as Development Specialist with Mon Health Medical Center Foundation, how do you factor into this?
So with Lotoya and I got together because of this program. So my side with this program is helping with funding. So doing a lot of grants, looking for funding sources, and also interacting with donors within the area.
Lotoya, what is the Mon Pathways to Success program?
Sure. It actually came about from our involvement with Leadership Mon, where Mon Health nominated both myself and Paulina to join that, which is a great opportunity for leaders in our community to get to know a little bit more about the needs. So we were talking as a group in that, and one of the members came from United Way, another one from our purchasing department at Mon Health, and they realized there was a true need and a gap with our unsheltered community, people in the workforce. How do we help them have greater access if they don't have internet access at home, computers, or just getting back to work? How do we help them? And so the conversation started flowing, and they mentioned it to Paulina and myself, and we're like, oh, we can definitely help with this. And Mon Health, we went to David Goldberg, our CEO, and said, what do you think? How do we help members of our community get back to work who have been made one wrong choice or just don't have the means? And he loved the idea of Mon being able to help people get back into work, joining the workforce, no matter their situation, if they're unsheltered, if they're just dealing with different poverty issues, recovering. No matter their scenario, we wanted to be able to give them actual resources and tools to get back to work to be more sustainable financially.
Our guest this morning, Lotoya Henry-Ojugbana, the Director of Talent Acquisition for Mon Health System, and Paulina Nottingham, Development Specialist, Mon Health Medical Center Foundation. We will continue talking about the Mon Pathways to Success program. Got to squeeze in a quick break first. You're listening to Mon Health Talk right here on the Voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Paulina Nottingham, Development Specialist, Mon Health Medical Center Foundation, and Lotoya Henry-Ojugbana, Director of Talent Acquisition at Mon Health System. Lotoya, what are the benefits that come from the Mon Pathways to Success program?
Sure. So some of the resources that are part of the program is each participant will have a few different tools. They'll get a mentor, a buddy. We give them access to bus passes, gas tokens. It's a paid job with full benefits, and they have 6 months with us to also attend monthly classes to make sure financially they're good, their health and wellness is okay. We're checking in with them to make sure they have every tool available to be successful in this transition back to work.
Paulina, who's eligible for this program?
So we have been working with local agencies, specifically at Hazel's House of Hope, but also other local nonprofits within the community who are helping. So this first cohort, we went based solely off of recommendations from those specific agencies. But as we continue to grow, those who will be, there's really not too many requirements. It's just people who are willing to get back into the workforce, willing to go into entry-level positions, and then hopefully have some career growth within the healthcare system.
And Lotoya, can you kind of give us and you've done this a little bit, but maybe an overview of what the participants experience and some of the training they receive through this program?
Absolutely. And so the experience really began with us going to them. So as Paulina mentioned, partnering with Hazel's House of Hope, we went to that facility to make sure we brought our laptops and helped them to sign up for jobs. It's really a hand-in-hand experience is what they're going to be getting, where they'll be working one-on-one with myself, the recruitment team, with Paulina, and we're partnering with the agency to make sure if they have any questions in the process, we are here to help them. They're going to be assigned a buddy during the program to make sure they're trained well with every position. Even if they have no experience, we are here to train them and help them be successful and offer different education tools so that they can continue to grow in their career.
And Lotoya, we talk a lot in the main segment of the Talk of the Town about trying to get folks back to work, folks who are needing that second opportunity, maybe third, fourth, it doesn't matter, but another opportunity to try to get things turned around. And I think when I say those things, this is the kind of program that I kind of envision in my mind, an opportunity to train and work and train and get that chance at, getting things back on the right track. Exactly.
Getting back on your feet, whether you're in an at-risk community or on someone's couch, or you've tried and you still can't make any headway. This is exactly that program to help with that.
And Paulina, there is a benefit not only to the individual in the program, but what's the benefit to the community as a whole with a program like the Mon Pathways to Success?
So the community as a whole will benefit from this because, like you said, those who need to get back into the workforce will be offered the opportunity, but also it will allow for the hospital to be able to fill some of those jobs that we haven't been able to due to, some entry-level positions. We actually dropped the GED requirement, college diploma requirement for any entry-level positions. So just really working on getting the community back into the workforce, I think, will kind of have a trickle effect and help the economy and hopefully get some of these individuals housed as well.
Lotoya, are you hearing any feedback about the program yet?
Yes. So a few of the participants have stopped in and just, again, shared how grateful they are, how they already love their job, because we've had a few people start already in the program, and the excitement and joy that we're hearing and their stories of where they've come from and how this opportunity has really started to change their lives already. It just makes it all worth it.
So when does the program start? When does it end? Is it going on now? What are the specifics?
It's going on now. Our first cohort of applicants have started working. Our last group is starting today. So first cohort is underway, and we'll be tracking it for the next 6 months. And then we'll accept a second cohort of individuals. Our goal is to bring on up to 10 each time, but we can always take more than that. We have 7 individuals who are part of the program now, and then we'll do our second cohort in the fall of this year.
And you're taking on about, what, groups of 10 or so? Is that what you said?
Yep, up to 10 or more.
Why does it help with that small group? I guess, do you get individualized instruction in a group that size?
Yes, especially since it's our first group. We want to make sure we know exactly what we're providing to them and being able to individualize the mentorship, because we're assigning a mentor to each person as well as a buddy to each person that starts in the program. As it grows and we get more participants, we'll definitely recruit more mentors and learn from our first cohort what it is that we need to do or change or do better.
Well, what's the point of the buddy in this program?
Yep. So it's important that we want them to feel like they're part of the Mon family and that they understand they have a support system. That buddy is someone in that department that they're hired into to work with them, help train them, be a resource to them if they are struggling at any point with the job duties, work duties, or just feeling acclimated to the workforce.
Yeah, I would imagine those personal relationships and like you said, knowing there's a support system there,
Yes.
Knowing that you have a mentor that you can learn from. Those are very important as you again, this is about giving folks another chance, getting the life turned around, getting things back on the right track, and having those things in place. I hear time and time again, Lotoya and Paulina, those are critical in folks achieving success in this type of venture.
Exactly. And that's exactly what we wanted to make sure that is in place for them, and they have that support system to lean on.
And something that Lotoya hasn't mentioned yet is with this first cohort as well, we're kind of doing a trial and error, and we're doing continuing education for the individuals that they have to go through each month. So we'll be having financial literacy, health and wellness, a roundtable, feedback, and so hopefully we'll be able to learn from this cohort of what these people need to get back on their feet, and kind of get into that transition of hopefully, maybe purchasing an apartment one day or just growing in that healthcare industry.
We're talking to Paulina Nottingham, Development Specialist, Mon Health Medical Center Foundation, and Lotoya Henry-Ojugbana, Director of Talent Acquisition at Mon Health System. And we're talking about the Mon Pathways to Success program. We'll continue our discussion right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Talking about Mon Pathways to Success program this morning, Paulina Nottingham, a Development Specialist, Mon Health Medical Center Foundation, Lotoya Henry-Ojugbana, Director of Talent Acquisition, Mon Health System. Paulina, how is this program funded?
Yes, so for the pilot program, the Hazel Ruby McQueen Charitable Trust actually funded this program through a grant that we had applied for back in December. And going forward, it'll be funded through other grants, but also if anybody just feels that passion to give back, we will accept any type of donations to continue to get the program going because we want it to be sustainable.
Lotoya, have you had any success stories early on? I know you said the first cohort is now working. Have you had any successes you can brag about so far?
Yes, I would like to brag about especially one of our new hires who's helping register our patients that come in for lab work. Since starting the program and having that stamp that she is fully employed and working, she's already been able to get an apartment near the hospital. Her transportation has worked out where she's been able to fix her vehicle. She's just one success story. She's stopped in how many times to say how grateful she is for this opportunity and already loves the team that she works with. In the hallways, we get to see two folks who've joined our environmental services team to help make sure our patient rooms are clean and we're meeting quality standards. And just to see their smile on their faces is just amazing. And every time I check in, they're excited and happy to be there early and on time and just showing that it's changing their lives is just all worth it.
That's good to hear. What have some of the challenges been to getting a program like this up and running?
Really why we got into it. The challenges are, the access to the internet, access to transportation. That's been a challenge with work schedules, but we've been able to work with them and make sure that we overcome those challenges. And it's the same barriers that stop them from getting to work, why this program is here. So even though we're putting in a lot of work to make sure each of them one-on-one are getting the resources they need, it's a challenge, but it's a challenge that it's worth it, and we're happy to help them overcome.
Yeah, it's some of the things that, you and I, we probably take for granted every day, just, being able to get to work. Or when somebody says, well, just go online and we've got the information there, that's A, not always accessible to everyone, and B, sometimes getting from one end of Morgantown to the other is a challenge on a good day for, somebody that's got reliable transportation, let alone for someone who does not. So I can see how all of those, again, things we may take for granted become very, very important issues for someone looking to get a second chance.
Agree completely, and that's exactly what we're seeing from these individuals.
Paulina, how can folks, if they would like to help out or want to learn more, where can they find more information or get in touch with you all?
Yeah, absolutely. So you can reach us at 304-598-1485 or at monhealth.com and just ask for Lotoya or Paulina, and we can help guide you wherever you need to go, whether that's you're interested in the program, you have a recommendation, or you possibly want to give back and help us sustain it.
All right, I'll give you each a chance to just answer a very quick question. Lotoya, what's the one thing you want folks to take away from our conversation today?
That it's important to stay in touch with the different agencies in your community. They all need help to make sure we're doing our part to help each individual person get off the streets or have those resources to food, some of the things we take for granted, like you mentioned earlier. Please reach out to your local agencies. They're here to help. And Mon Health, we're here for employment to help those who need it. We have awesome opportunities for growth. Every position you could think about, we probably have it. So please reach out. We're happy to assist.
Paulina, same thing. What do you want folks to take away? About 20 seconds here.
The biggest thing is if you have an idea to help people, to do it. We brought this together in about 6 months, and, we decided we were going to be that industry moving forward that was going to help get these people back to work. So if you have an idea for a program, there's no better place than Morgantown to try and get involved.
Paulina Nottingham, Development Specialist, Mon Health Medical Center Foundation. Lotoya Henry-Ojugbana, Director of Talent Acquisition, Mon Health System. Guys, enjoyed the conversation very much. Thank you.
Thank you. Bye.